Then our next team is that its technology is Taiwan province's leading international technology, which is the precision treatment technology of degenerative cartilage of knee joint. What about this technology? -1, and by Ching-Chuan Medical developed it, then invited Jiang Ching-Chuan Deputy Hospital.
Good afternoon, everyone. Everyone is advanced. I'm here to share this with you today. Cartilage regeneration involves RD and clinical sharing. These are two ancient cartilage regeneration items. Its current product has been called RevoCart in the Cyprus layer. This is our first class 3 medical product in Taiwan that has undergone complete clinical trials and passed FDA certification. Let's take a look. This normal cartilage is on the left-hand side. Sometimes that cartilage will break down. There is nothing special about this at present. There is no special way to cure it except the crown joint. What about the past? Everyone thinks that software will not be regenerated, but what about this one in 1994? Because after the cell culture technology comes out, it can be retried. Well, I was originally working with a team of vitro at National Taiwan University Hospital. We jointly ordered a topic called cartilage regeneration by the host in 2000. Then our original idea was that if you don't want cell germ, you can give it to him once on the operating table. What about here? The engineers of vitro, they are very powerful, so use enzymes to treat them. When there is enzyme treatment, the cells will be released, and then there are two materials. On the one hand, it can regenerate bones, and on the other hand, it can regenerate cartilage. The operation needs to be very simple, with only 4 steps. When the operation goes in, take a little, and the patient will no longer be stressed. Do enzyme treatment, and then put it in the cutting once after the treatment is completed. The whole process takes 1.5 hours. You can see that the whole research and development process has gone through nearly 20 years. During these 20 years, it has gone through large animal experiments, and it has been coming. There are many papers published in it. You can type in my name, and you can probably see these papers. So what's unique and different between our current technology and cell therapy? Our main thing is that we use patient autonomous cells of the first generation. After enzyme treatment, put it back, there are many cells on the market now. The treatment is to take them out and cultivate them. The cultured systems may be the 2nd and 3rd generation systems. The biggest difference is that they are all produced by ourselves, but we are our own native cells. The cells are not cultured, so the time we operate is 1 operation. What about cell therapy? It may need 2 surgeries. Cultivate the cells first and then come back. The biggest difference is the big animal experiment here. We use the animal experiment of pigs. You can see it on the right-hand side. After 6 months of implantation of this carrier, its cartilage is regenerated. But we use cell staining to see this regenerated cartilage, which has the same personality as the original cartilage. Whether you look at it with a microscope or naked eyes, this software is the same as our native allergy software. Some people questioned whether your regenerated cartilage is enough in India. When we go to do a stress test on it, our regenerated cartilage has the same biomechanical properties as the original cartilage itself. The original one is black, but the regenerated one is red. If it is fibrocartilage, it is blue, so ours has been verified in complete animal experiments. Then we entered the first phase of clinical trials, with a total of 10 diseases. What about these 10 patients? We published it in the Stock magazine in 2000 and 2013. And you can see that these 4 patients have finally exceeded 15. Then these 15 patients have been tracking them all very well. And then we enter the second phase of clinical trials. The second phase of clinical trials is 46 in the experimental group and 46 in the control group. Then the gold standard we use is bone marrow stimulating hormone. Then we have 10 medical centers all over Taiwan. It was not so easy to accept 92 patients in more than 10 years, so we finally completed the acceptance in 2019. Let me show you in the phase 2 clinical trial, a mother who uses our carrier. What about this mother? Why should she accept an impact career? At that time, when Taipei was excavating, she couldn't take her children to see the bags. She had to sit at the door and wait for her, so she was very sad. So she just got the definition result of our experimental group. He was very happy. Gave us a complete long-term tracking and what? He made the biopsy for us in a unified way. From the biopsy, we can see that it is grown cartilage. Not only cartilage, but also real cartilage. And its extracellular message mechanism is very healthy because it can be stained with this. It is not only the chondrocyte. And its extra 7 matrix is Ching-Chuan. Let me show you this one. This one was also drawn to the experiment. He was a student in the law department of National Taiwan University at that time. Because his feet swollen when training 800 meters, he joined the clinical trial. What about 10 years later? He will come back and show me again, huh? Don't follow him. Be 10 years later. Okay, I'll tell that story and he will come back and show it to me 10 years later. Then he is a lawyer himself and a former leader of this group. He is a lawyer himself. He agreed to let me interview and provided his video for everyone to watch. The one who ran the fastest in it was the second person after the operation. He not only won the gold medal in 800 meters, but a year later he broke his own record and then he accepted it. May I ask him to sign a consent form that allows you to do this and let Rang do a Japanese-style publication? So this RevoCart is the first drug certificate in Taiwan province after completing clinical trials. What about the indications of this medical material? It is the medial orthopedics of the knee joint and the lateral orthopedics of the knee joint, as well as the cartilage repair of the occurrence area. So any cartilage defect in this part, whether it is a sports injury or degeneration, can be applied. Let me show you. This one is a global generalization of cartilage regeneration products. We are here, we are in this place. After 20 years, we are still standing here. Many products here, some of them, have been off the market, and the products in the United States have been off the market. Therefore, it means that our one is characterized by our one-time regeneration. I can share clinical experiences. The disorders of the knee joint range from young to old with cartilage defects to severe drug-resistant arthritis. The ancient cartilage in the middle part is excessive. There is currently no good treatment. When it is more serious, it is necessary to treat Biogend bone, high osteosis or hip joint, but we provide a new treatment at this time. Let me show you, this is a 19-year-old boy. He dances ballet. Then he has a hole here, this ancient cartilage glass. He can't continue dancing here. Then after he came to receive this treatment, 6 months after 6 months, he went back to Paris and wrote me a thank you card, saying that he could participate in Posado 5 training. Okay, the next one is an 18-year-old basketball player who is training a professional basketball player. He is from the United States. He injured his knee while exercising, so he broke it after the first 10 sounds, and there was a cartilage defect here. After we helped him do ligament reconstruction at the place where the cartilage defect was, he did this cartilage regeneration bone carrier. Look, everyone, the one who jumps up is he. And this one is here after the corn operation for a year. Then we also get his consent and we can introduce it to you at coffee. It's only 30 seconds. Let's relax for everyone. Look at this player who has undergone surgery for cartilage regeneration. It's him. Originally it was always up now, but now it is equivalent to a sole figure of their team. Boom, finally. Therefore, when it comes to cartilage regeneration, we have combined ligament reconstruction and soft regeneration. The patient can still restore his original performance professional level, so this is a 45-year-old nurse. Originally, he had a knee joint and there was such a cartilage defect, which was very painful. this layer. What about arthroscopy before, but no treatment was done? After we helped him do cartilage regeneration, what about this section? I don't think I should die here. The most important thing is that he also agreed to let me visit. It's mainly surgery. What about before? He has a lot of pain when he has to go to work, so he always has lacrimosa at night. This is what he said. Well, after we have done this operation for him, he doesn't have to take painkillers now, and he can happily go to him to do his work. And then this is one of the 11 who came back to the United States at the age of 76. A male, when he showed it to me, there was a truth here and here, because his feet would walk like this, limping one by one. So let's let him look at the next one after he was hospitalized. I will see the outpatient clinic on Monday and arrange hospitalization on Tuesday. I will have an operation on Wednesday. I will fly there on Saturday. So far, all my problems have been solved. Let me show you. So far, this has been used on the market. Fujian Catholic University. I retired from National Taiwan University Hospital, now at Fujian University. By October 25th, we've treated 25 patients, some ischemia, early degenerative coronary blood fingers, young cartilage comparison around 5. Thank you for reporting to everyone.